One of the techniques that I learned at the most recent seminar that I went to over the weekend helps with sinuses, it helps with headaches, it helps with any fractures you might have had in your eye area, through the cheekbones, this kind of thing, anywhere through here. It's kind of strange, so you may want to do it at home, uh, but we all have issues with our nose, whether it was broken, whether surgery, whether it's just how it was shaped, how it was formed as a child. None of us are born with perfectly asymmetry bodies, because the birthing process is very traumatic. So things get smushed and things get pulled and things get shifted and things get changed, and these create problems. Maybe not as a child, but then as we get older, there is definitely some issues. Um, Me specifically, there is one nostril that is bigger than the other. So let me just kind of straighten my head a little bit here. All right, maybe that works. No, hold on. There we go. So you can see this side extends further out than this side, than that side. I'm trying to do it through the screen. I'm backwards. And if I look backwards, you can see how much this side is closed compared to this side. Now, I, for the most part, have breathing problems. I do have some sinus issues, but for the most part, I just contribute. I have animals, so which you can see her sleeping back there, waiting for me to stop playing on the computer. So the technique is you can use lube if you want, or some kind of lubricant, but it's your nose, and you're not going to wear a glove to get in there. But we were wearing gloves, so we had lubricants. But pick a side, doesn't matter which side. So for me, when I'm going to self-treat, obviously I'm going to self-treat this nose, because you can see that the way that it's being pulled. And this is where, if you have an issue with people putting their finger up their nose, you may want to stop watching. But it is a very wonderful technique. It seems weird, but it actually doesn't really hurt. It hurts if you have issues in there. And the longer you hold it, the more it's going to shift and open. So typically you want to hold any treatment for a good 3 to 5 minutes, but if you can do 10, that's even better. And then what you do is, once you actually enter into the nose, you're going to stop where you feel pushback. So there will be a feeling of like a ring of cartilage, or just something a little bit more dense in there. And so when you hit that spot, hold it. And then once that starts to loosen up, your finger will go deeper and deeper and deeper. And you don't want to go too far in. I mean, come on. Like, if I put my nose up here before I even hit anywhere near my eye, I'm at my knuckle. And, that's going to, be more than sufficient. But if you need to go all the way back, go all the way back. Because in the end, there's a lot of airflow through here. We have openings all through here. As you know, the bone starts back in here. But that's the technique. So, and what it looks like is, and like I said, if you have an issue with seeing people put their finger up their nose, which I was kind of weird about it at first myself until I did the technique because I had to, yeah, then you can stop watching. All right, so anyway, what you're going to do is take your finger. I'm going to stick it, wait, I want this nose, this side. I'm going to just stick it up in there, right? Hold, because I feel where my spot is. You might feel pulsing, you might feel burning, all normal. And trust me, this is not going to make your nose super big. All you're doing is releasing the fascia that's in your nose and along your bones in the front of your face. And I have my elbows on the desk here just for support, because if you're trying to hold your arm up, obviously you're going to get fatigued with that. And then just close your eyes and breathe. Obviously, I'm talking, so my eyes are open and I'm talking. And as you close and relax and shift, you want to go to where you feel like the pull needs to go. So I'm kind of angled this, like I'm trying to show it. So obviously I'm kind of angled this way into my septum. And most of us have a deviated septum, which is why we have sinus issues and breathing problems and snoring and things like that. And then once you've hit that spot for a while, might be sensitive. And if it is, as long as you're not flinching or heavy breathing to suck it up, it's okay. If you are, just slightly back off a little bit or shift what you're actually touching, okay? And then once you feel that move, you're going to take up more slack. And like I said, this is going to be a shorter demonstration, but the more time you spend on it, the more that it releases. The more that it releases, the more you have relief. So do it at home, especially if you're really clogged in the sinuses, and loosen everything that's stuck up in there. And then once you're done, just take your finger out and breathe. Like right now, my nostril looks weird, but as you can see, it's a little more open than it was when I first started. So I need to work on my nose, obviously, and open up that side. That's way too tight. This side's a little more crushed, I guess, through here, which is creating some of the pull here. But you know, not that I recall of having any kind of nose injury or anything like that. But regardless, could have been from birth. Could just be life. Could be I sleep on this side too much. You know, smushing my face. God knows only. But you know, it is a wonderful technique that will help you move forward in a very wonderful way.